Hi, it's Gilton Jimenez. I'm going to talk about Rivaroxaban in patients with heart failure, sinus rim, and coronary disease. Definition. Rivaroxaban is used to prevent blood clots from forming due to a suddenly irregular heartbreak or after hip or knee replacement surgery. Heart failures occurs when the heart muscle doesn't pump blood as well as it should. Sinus rhythm, the normal regular rhythm of the heart set by the natural pacemaker of the heart called the sinoatrial or sinus node.
Your heart is a muscle that pumps blood around your body. The term heart failure can sound frightening, but it simply means that your heart can't pump blood as well as it should. Heart failure can be caused by a number of things, most commonly a heart attack, high blood pressure, problems with heart valves, or cardiomyopathy, a disease of the heart muscle. Joe has just been diagnosed with heart failure. Because his heart can't pump blood around his body as well as it should, it's causing symptoms in different parts of his body. When blood isn't flowing properly, it can lead to a buildup of fluid or congestion, a bit like a traffic jam. This fluid sometimes builds up in Joe's lungs, leaving him breathless. Fluid can also build up elsewhere in Joe's body. He notices this as weight gain and swelling in his feet, legs, lower back and abdomen. Joe also suffers from fatigue because his heart can't deliver enough oxygen-rich blood to his muscles. With your continued support, we're funding research to one day find a cure for heart failure. Right now, Joe uses medication to manage the symptoms and help him have a good quality of life. Joe has also made some lifestyle changes to help keep his heart healthy, such as quitting smoking, cutting down on alcohol and salt, staying active and keeping a healthy weight.
Application in medicine. Used to DVT prophylaxis after knee or hip replacement treatment or DVT and PE. Stroke prophylaxis in atrial fibrillation and reduction of cardiovascular events in patients with coronary artery disease or peripheral artery disease.
If you're like most people, you think that heart disease is a problem for others. But heart disease is the #1 killer in the US. It is also a major cause of disability.
There are many different forms of heart disease. The most common cause of heart disease is narrowing or blockage of the coronary arteries, the blood vessels that supply blood to the heart itself. This is called coronary artery disease and happens slowly over time. It's the major reason people have heart attacks. Other kinds of heart problems may happen to the valves in the heart, or the heart may not pump well and cause heart failure. Some people are born with heart disease. You can help reduce your risk of heart disease by taking steps to control factors that put you at greater risk. Control your blood pressure, lower your cholesterol, don't smoke, get enough exercise.
Pros and cons. Pros. Plays an important role in coagulation cascade, in promotes viability, growth, and migration of endothelial cells, protects them from the pro-inflammatory effects of the factor X, improving endothelial function. Rivaroxaban has fewer interaction drugs that warfarin doesn't interact with food and does not require frequent blood tests. Cons. Rivaroxaban is only available under the brand name Xarelto. It can be more expensive because there is no generic option available. No States, there is no antidote available for Rivaroxaban. Issues played in a war. According to the latest World Health Organization data published in 2017, deaths caused by coronary heart disease in Ecuador have reached 8,341, 11.54% of all deaths.
When you feel well and you don't have symptoms, it's hard to imagine that something is going on in your body that may be harmful. We know with heart disease that there is a long asymptomatic period where people don't have any symptoms. While someone might have a heart attack at 70, the coronary artery disease has likely started when they were in their 30s for decades and decades. Unfortunately, there's no symptoms until it's too late and someone's had a heart attack or they have heart failure or they've had a stroke. The majority of people that have high blood pressure don't know it. In addition, high cholesterol, the vast majority of people don't know that, and you have to get a screening blood test in order to detect high cholesterol. The American College of Cardiology and the American Heart Association has a risk calculator for 10-year or lifetime risk of developing cardiovascular disease, and we recommend people talk about that with their doctor. If you lower your blood pressure by 20 millimeters of mercury, you half your risk of dying of heart disease. If you lower your cholesterol by 50 milligrams per deciliter, you half your risk of developing coronary artery disease. And if you're a smoker between the ages of 35 and 44, if you quit smoking, on average, you'll expect to live 10 years longer.
Heart disease is still the #1 killer in the US, but there are some simple steps to reduce your risk factors. Cardiologists recommend following a few simple healthy lifestyle habits and getting regular screening tests to reduce cardiovascular risk.
By focusing on not smoking, getting regular exercise, eating a good diet, maintaining a healthy weight, and avoiding or treating high blood pressure, high cholesterol, and diabetes.
Conclusion: Rivaroxaban at a dose of 2.5 milligrams twice daily was not associated with a significantly lower rate of death, myocardial infarction, or stroke than placebo amongst patients with worsening chronic heart failure, reduced left ventricular ejection fraction, coronary artery disease, and no atrial fibrillation.
So I'm here at the European Society of Cardiology Heart Failure, and happy to present as part of the COMPASS team the sub-analysis of the COMPASS heart failure sub-study. Specifically, as we know, COMPASS was a large multi-center, multinational trial, which found that use of Rivaroxaban, 2.5 milligrams twice a day, plus aspirin was superior to aspirin alone in patients with chronic stable coronary artery disease for major adverse cardiac events, net clinical benefit, as well as mortality. In the sub-study, we looked at patients specifically with a clinical diagnosis of heart failure at baseline to see if they had similar effects. Indeed, what we showed is that according to the hazard ratios, the relative risk ratios were very consistent across the spectrum of whether or not the patients had heart failure or did not have heart failure. There was no significant interaction between those with or without heart failure, although interestingly, we did see a significant improvement in absolute risk reduction for those patients with heart failure. Patients with heart failure had an absolute risk reduction of use of Rivaroxaban plus aspirin as compared to aspirin of 2.4% with a number needed to treat of 42. This in comparison to patients without heart failure with an absolute risk reduction of 0.9 and a number needed to treat of 111. If we looked at the safety effects, that is major bleeding, we saw no significant difference between the patients that were treated with heart failure, although there were increases in patients treated with Rivaroxaban plus aspirin as opposed to aspirin.
Thank you.